everyone. This is chapter 2, which is our human movement system or human movement science that we're going to talk about, and basically breaking down how everything moves. It's a quick venture into some kinesiology, a little bit of motor learning, a little bit of motor control, just a simplistic version of the anatomy component of everything. So, we're going to go through and just kind of touch base on all of these because this is not something that we cover in great detail, but rather something that has been established from previous, personal training information, or it's been established from previous information during class time or anything like that. So this is more of a follow-up to that, so we can kind of go through and just kind of get reacquainted with some of the terms that we've been working with over the last few years, especially during our associate level stuff. So in the first term, first bit of terms here, the functional anatomy piece, you have your four terms of your agonists, antagonists, synergists, and your stabilizers. And all four of those are, specific roles that, your muscles play within your system. So looking at your agonists, we know that term refers to the prime movers. If you're trying to do a squat, we know the prime agonist or the prime mover is your quads, with also an agonist being also your glutes. All right. In terms of that same squatting motion, the antagonist or the opposing muscle group is the hamstrings. Obviously, on the other side of the body, they are meant to be there to not really assist, but to be non-functioning. And that's when we have synchronized movement, is that we don't want the hamstrings to fire when the quadriceps and the glutes should. So that's just an example of that. All right. Synergists are those that assist your agonists. So, in terms of, again, that squatting motion, what are the muscle groups that are working there? Your hip flexors, something as simple as your sartorius would be a synergist to that. All right. And then lastly, your stabilizers, which are those that, they assist and support the joints while your prime movers and your synergists are making that movement happen. Okay, so a stabilizer would be the adductors, during a squatting motion. Okay, just to make sure that legs are staying in proper organizational form. Okay, so that's your four roles there. As we move through, you'll notice that with everything that we're gonna talk about, yeah, we're gonna really hit on our leg muscles. We're gonna get into the hips, the abs, your back and chest, your arms and your neck, so your upper and your lower functioning here. So when we look at your assessments in the following chapters later on, or when we even get into things like activation and inhibition, all right, all of those things will talk about these regions here, your legs. So we're talking about the lower leg and the upper leg. Your hip, that's your lumbopelvic hip area. So that's anything from low back to quadriceps, it could be hip flexors, your hip extensors, your ab and adductors, all right? Your abdominal muscles, that could be anything centralized, so it could be your obliques or your abdominals, right? The back and chest, so we're talking about major muscle groups of the upper back. So now we're talking about like the lats and the traps and the rhomboids, things like that. Whereas your chest, you're more concerned about, really, that could be anything from pec major, minor, in that form, because we're talking about gross musculature here. And then arms, your arms, tris and bis, and then your neck, it's sternocleidomastoid, levators, okay, any of those areas. And if you want more, I can definitely give you guys some more information there in terms of, the whole anatomy that you'll discuss throughout this whole book. All right, and we have some PDFs for that we can hand out. So with motor behavior, what are we talking about here? So what we're talking about when we talk about motor behavior, this is basically taking the big picture of how we move, all right, and how it's a combination of your motor control, your motor learning, and your motor development. And motor behavior can change over time because we can learn and develop new skills, right, while controlling our system in a synchronized fashion. All right, so let's get down into the motor control component here. So with motor control, we're talking about, if we're talking about pushing and pulling movements, we're talking about sensory information. All right, so sensory information, the external environment and even the internal environment, you're sensing specific information, all right, and things that you're able to feel, things that are being sensed from the outside environment. It could be anything as simple as, temperature, all right? Whereas then you work into that proprioception part of everything, and that's where we talk about neuromuscular efficiency. Proprioception is you're being able to sense how the body is in relationship to things like stretch, things like tension, stretch and tension at the same time, all right? And at that point there, what we do is we end up with what we call sensory motor integration, where we take what we've felt and compensate our movements to that specific area, right? Or to those muscles that need to work. And then at that point there, we end up with muscle synergies, where now you have muscles that are acting accordingly, in the right way. They're firing at the right time, the right rate, the right amount of muscle fibers, so that you're not fatiguing the body while also keeping some in reserve, but you're also getting muscles, different muscles, to be able to fire and create this movement that is more coordinated and less jerky. All right, so if you're looking at, for example, the pushing movement on the right hand side of this, you're looking at the bench press. Well, with muscle synergies, it's, how are the, really the main focus is how the triceps are working in alignment with the pecs to be able to propel that. Well, if you don't have proper wrists, are your, you know are you dealing with your hands in the correct manner? That can prevent you from using the triceps in a, full on manner. So these are things that you worry about. Are you using your feet to help? So if you're using your feet, are your gastrocnemius and your soleus propelling your butt, the whole kinetic chain all the way through? So there's a lot of things that come into play when we talk about synergies, okay? And then from there, what we talk about is how, with motor learning and development, is you end up, with that motor control, those four components of the motor control piece. You're going to then have motor learning, where now you're getting feedback from both internal and external environments, and your body knows how to adjust based on results and performance that you've seen and the feedback that you've felt, meaning the internal is sensory feedback, and then the external, which is the augmented or movement, movement external feedback. So your body starts to learn what feels good, and meaning, feels good, and then shown through performance. Okay, so when you're working with, just say a lunge, for example, if you know that when you step down with that front foot, and if you step too narrow, you know that your base of support is compromised. All right, so if you think about it from the motor control piece, all right, we're sensing, we're propriocepting, then we're integrating our muscles to then, create a movement of all of those muscles that are involved. So with a lunge, what you're going to see is, just say you have someone who's coming back from an injury, and they're working with you, and that they step down with that front foot and they are really wobbly. Well, the body senses that, and it's going to then try to change and give feedback to the brain, to the spinal cord, to then create better nerve signaling. Well, over time, you're going to realize that your performance and your results are getting better the more you do it, because now sensory, and augmented feedback are ultimately becoming improved because of the movement patterns of your muscle synergies, and you start to feel that. Well, it's the same thing over the lifespan. As a kid, you might have a really hard time lunging. Then as an adult, you realize that a lunge is a pretty easy task, and then as you fade into older adulthood, that lunge starts to kind of revert to what you were as a child, where it becomes more challenging again. Well, motor learning is all part of that process as you go through the age spectrum as well. So that's part of it that you also can understand, is to go along with that. All right. So then what happens here is, you've understood, okay, so we got some functional anatomy. We have, we understand the motor portion of it, nervous system and muscle system integration and how that works hand in hand to create better motor behavior. Well, what happens with muscles? All right, well, muscles end up with what we call a length tension relationship, whereas, you know, this is the one part right here that we don't really want to kind of take into play. So if we look, at our, the term here, oops, if we look down here at, muscle imbalances, in this manner right in here, all right, muscle imbalances, what we're talking about is, what's overactive, what's underactive. So if you have something that's that's overactive for our piece here, this part, and it's shortened, what that means is that those muscles are tight. Okay, so with an overactive muscle, if it's tight, that means that we have to stretch it out. Okay, if it's shortened constantly, that means it's overactive, means it's being contracted when it's not supposed to. Underactive, on the other hand, is lengthened. All right, and if it's lengthened, what we're saying there is that if it's underactive, we are basically taking a muscle that is not being used. It's underactive. It's weak, and we want to make it so that it is, that it's stronger. All right. Well, the problem with that is that it creates these muscle imbalances, which then throws off this term over here. If we look, the force couple, all right, force coupling relationship, that there is one of those things where you're basically using a multitude of different muscles to create a force that's coupled that will create a proper movement pattern. Well, if you look, I know it's hard to see, down in that, down over here in this region over here, if you follow the cursor over here, your serratus, and then your lower and your mid traps, they're trying to make it so that you have upward rotation of the scapula. And so by doing that, what happens is if the serratus anterior pulls, the lower trap pulls, and the mid trap stabilizes, what you're going to see is what we would call so the arm is going to go in an upward manner like so, up that way, and that way what we called is, ABD, or abduction. Okay, and that's really what we're trying to see there. All right, but without the use of, these three motions, if you see here, this is where you have your, your arrow pointing that way, your arrow going down, pulling here, stabilizing here, and then pulling in this upward direction over here, then the arm can move in that way. All right, and that's what we would talk about in terms of a force coupling, is those muscles are firing correctly to stabilize or to pull, which allows, for that motion to occur. Now, if you have muscular imbalance of any of those, if one of those is tight, well, we're going to have either a very challenging movement, okay, or we're going to end up having, we're going to have a really challenging movement, or what we're going to end up with is a really bad movement pattern. So this right here, for our muscular imbalances here, we have to be very careful of that and make sure that ultimately, we don't, those cannot go on for so long, because that's that cumulative effect of injury that can occur at that point. All right. So then we kind of talked about the RI model in the chapter 1, which is the regional interdependence model. But when we look at it, so when we look at everything here, we showed that there is this connection point between our human movement system. All right, so what we have to understand here is that for optimal, neuromuscular efficiency, as we would say, and if we kind of, build this up a little bit more. So if we open, let's see if we can pull this. There we go, a little bit bigger of a visual. If we look at everything, with optimal neuromuscular efficiency, if we have proper posture, okay, if we have posture meaning, are we in proper alignment? Are we, if we were to take and look at our system, which will show in the assessment how to assess, body functioning and or body image in terms of, a string line. Are we in alignment? Well, if any point we're out, well, that's going to create things like length tension relationship changes. It's going to change how our muscles force couple together, and therefore it's going to end up with, an arthrokinematic problem that will occur and it won't be optimal. We'll then look at structural efficiency, all right, and look at how, if posture is broken down, well, where are we structurally broken down? What area? Or do we have a forward head tilt, things like that? Do we have shoulders that are set back too far? Well, what's causing that? And we can go from there. And then lastly, functional efficiency, where, with movement there, are we, with our movement, are we able to see that? So ultimately what we have to understand is that without this regional interdependence model, you have these three things that are missing in terms of your postural and structural, and your postural component, your structural and your functional efficiency. You end up with something that really creates bad kinetic chain movements, and then this is no longer, you're not what we would then call optimally neuromuscular efficient. Okay, so there's an inappropriate concern at that point. So we're always going to be assessing for that. We're always going to be looking for that. The professional has to understand that there's way more to it than just that. Okay. So when we look at our local, muscular system, all right, and we break down everything, what we want to see here is that, for our sake, we want to see that, these muscles are supporting everything that we're going to be doing. Okay. And so for our sake, when we look at everything, our local muscular system here, all right, we're talking about the transverse, okay, abdominis. We're talking about the multifidus. We're talking about the internal obliques, the psoas, our diaphragm, so our breathing musculature, and then our, what we would call our pelvic floor. Muscles, okay? Those are all part of that. So these are the 5 regions now. 1, 2, 3, oh, 6, my bad, 4, 5, and then the pelvic floor muscles are more than that. But those are primarily type 1 muscles, okay? They are, so if there's slow twitch, we know that they are, so just to kind of, hash it out, slow twitch, we're talking about high fatigue, resistant at that point, okay? Which means that they are not going to get, tired as quickly. So that's really one of the good things there. So if our local musculature, system is all about making sure that we stay stable, then ultimately what we're saying there is that we don't want these muscles to fatigue out, and our body is already made for that purpose. All right. So those are the muscles that we have. The muscle fiber types are slow twitch, and what is their main, issue is to, have joint support. All right. One of the examples there is the drawing in maneuver. Well, that's this right here, your diaphragm completely. All right. So with your diaphragm, and everything that we have with it, we want to make sure that we take in that breath, in terms of that drawing in maneuver. We don't want to breathe through the belly at that point. We want to be able to drag that diaphragm down and make sure that when we draw in, it makes the, the transversus abdominis, the internal obliques, the rectus abdominis as well, and it wants to pull that there and hold it and lock it so that your system can stay upright. So you want to do something like that, drawing in, for example, when you're doing like a squat or a deadlift, where we want to have the spine to be stabilized at that point, and that's really what we're looking for. So, local muscular system, definitely more internal, more closely linked to the spine, all right, and the pelvis, all right, and it's going to help us to maintain that proper line of function. Global, on the other hand, and make sure, for your testing, make sure that you understand all of these components here. But when we look at you know, the global part of everything, we're looking at more, we look at fiber types here. So we'll say type 2. Okay, so they're more fast twitch. In nature. Okay. So we're looking at things like the different subsystems here. Like it says the deep longitudinal, the posterior oblique, the anterior oblique. All right. And the lateral subsystems. And those are the areas that we are going to be, that are going to be of concern. So those 4 subsystems will ultimately be able to give us proper movement, more so than it's going to be more about the stabilization component of everything. All right. So what we're looking at here is proper chain functions. All right. They're more about making sure that it's large muscles that are firing to create better movement, but also still to stabilize at the same time. Okay. So local meaning more internal, more supportive, whereas, and again, more, joint supportive for, and obviously we talk about the trunk and everything like that. But then here we're talking more about, like I said, the more movement component of everything. So anything from quads and hamstrings to lats to glutes, all right, anything along those lines. All right, so if you look here, if you look at your deep longitudinal, you can see biceps femoris, peroneals, your tibialis anterior, tibialis posterior. All right, those are all part of that deep longitudinal. All right. Whereas your posterior oblique, you'll see here that your posterior side point is your lats, what we call your thoracolumbar fascia, which is the fascia that holds together the components of your lats down into your pelvic region, into your SI joint, and then your glutes are also part of that posterior oblique as well, more side based. All right. For your deep longitudinal, though, these are just part of it. But if we look, we have your erectors. That's all part of it. All right. We talked about there's your thoracolumbar fascia again, your sacrotuberous ligaments. So within your sacrum, we talked about your biceps femoris, your tibialis anterior, and then your peroneal, or what we call your fibularis longus. So that's more, even though that's more oblique or more lateral, it's still part of that deep longitudinal, long subsystem. Okay. And then, we talked about the glutes, we talked about the lats and the thoracolumbar. That's all part of, any proper movement. And then again, the lats, if they're too tight, they can cause spinal deviation. The glutes, they can cause, your hips to be disrupted. So there's many different reasons why, even though they're larger muscle groups, that this is happening. Okay. Getting down to your anterior oblique, so more front side, internal and external obliques. You're looking at your adductor complex. So if we look down, for the body purpose here, your adductors all falling in, these regions right in here. All right, internal, the more medial side of your leg. All right, and then your hip external rotators. So things even like your glute medius could be some part of that. Your TFL, those are all part of that as well. And then your lateral subsystem. Again, there's your glute medius as well, your TFL, your adductors, again, more internal at that point as well. And then also your quadratus lumborum, or your QL, lower back musculature. And if you look, this is the one that a lot of people experience with their low back pain right in this region here. I don't know why it should be drawn out, but it's not. So, yeah, so we want to make sure that, these are staying in optimal health as well. But yeah, your QL, that's usually something that really fires up when you're having that low back pain. All right, so so again, your 4 subsystems. Going back, you have your deep longitudinal, posterior oblique, and then you got your anterior oblique, and then your lateral subsystems here. Okay. So now, again, what happens, in terms of movement impairment? Well, we have to understand that, it has to start somewhere. Okay. So what we end up with is what we call your cumulative movement cycle. So this is number 1, number 2, number 3, number 4. Come on over to number 5, and then lastly number 6. This is your cycle. With tissue trauma leads to inflammation, which leads to involuntary muscle spasms, which then leads into the adhesions that form on your muscle groups. At that point, if those adhesions are not taken care of, that can lead to what we call altered neuromuscular control. And then over time, this is with time, leads to muscular imbalance. All right. And this is pretty predictable. So what happens here, though, is that this will then slide right back up into here, and you'll end up with higher levels of tissue trauma. So you'll end up with more inflammation. You'll end up with more muscle spasms, more adhesion. So you can see, and then over time, so then it comes back here again, and then you're like, oh, look at that. More trauma again, because you just keep getting worse and worse and worse. And then you hurt more and more and more. So you have to be able to find a way to take this tissue trauma and try to work on steps 3 and 4 here so that you can work with that, okay? And understand that, muscle spasms can occur, but that's if we don't take care of the inflammation, and then at a greater distance. And then ultimately what we're saying here is that if the adhesions form, how can we break down those adhesions so they don't change our movement patterns? All right. So again, with that, with movement impairment, some of the terms we want to discuss is, again, static malalignments here. What we're talking about is what we call pattern overload. With pattern overload, that's, repetitive aspects that we work with. Okay, you end up with altered muscle recruitment. And at that point there, what that includes is things like what we call altered reciprocal inhibition and synergistic dominance. So when we talk about muscle recruitment, synergistic dominance, we don't want our quads to be the most dominant, upper portion of our leg that we can. We don't want to have, the hamstrings be the dominant one. What we don't want to have are, if we're doing a squat, we don't want to have our hamstrings be the dominant, muscle group called upon, because the quads aren't strong enough. All right. And then when you end up with that, that would be synergistic dominance, where, or even so much as so if you said, oh, well, the adductors are taking over and they're becoming synergistically dominant, what that means is that you're going to start seeing a bowing in of the knees, because those muscles are firing way more than your quads and your glutes are to be able to raise you up. So now you have these, knock knees happening. All right. And then also we talked about altered reciprocal inhibition. We're basically having altered patterns of, this is what we were talking about, where when you squat, you're supposed to be calling upon the quads and the glutes. Well, if the hamstrings turn on, they're supposed to be turned off, and that's what inhibition is all about. You're supposed to have those muscles turned off at that point. So therefore you end up with bad movement, because hamstrings are firing when they're not supposed to, but they're doing it because the quads and the glutes just can't do it. So it becomes a challenge at that point. All right. So then at that point, you have static malalignments. You end up with these altered muscle recruitments. So then that leads to dynamic malalignments, and that's usually with movement. All right. So if you look at a lack of flexibility as potentially the cause for that, that means that under movement constraints, you have bad patterns of movement as well. All right. So this is kind of what I was talking about when we were talking about assessing. But if you look, this line of sight right here, you can see that it, where's your checkpoints? Well, first off, when you look at the head, it's your ears, shoulders, hips, knees, and then your ankles. Okay, those are the 5 checkpoints. 1, 2, 2, 3, 4, and 5. And if you see here, pass through the ears. All right, when it goes down, what we're looking for there is we want it to be going slightly through the shoulder, pretty much, through the hip, but then a little bit behind the knee, and then through the ankle. All right, so that's the 5 key points there, is that, if we're looking at it from that standpoint, even if we go from the floor up, ankle, slightly behind the knee, through the hip, either through the shoulder or slightly in front of it, and then right through the ear. And those are the checkpoints that we want to pay attention to. And we'll talk more about that with the assessment component there as well. All right. So the last thing, with everything, just making sure that we pay attention to those components. We want to make sure that no matter what we do, we want to take, and the more we learn about the continuum here, is that we want to be able to restore optimal movement patterns. That's the most important thing here. Remember, we cannot diagnose. Our job is to get us to get back to higher fitness levels by creating a better motor state, muscle state, nervous system state, so we have proper alignment of all of those things and have coordinated movement like we're supposed to. All right. I appreciate everybody taking the time to listen. Hopefully you got something out of this. And again, you can always feel free to reach out and ask some questions. So have a great day.